Okay, good morning, DXN. Good morning, DXN Nigeria. Good morning, DXN Africa. Good morning, DXN Worldwide. We are back again from the stables of DXN Nigeria live stream. We bring to you another informative, educative, interactive section with DXN Nigeria. And I am once more, I'm your host, Samuel Zoro, marketing manager for DXN Nigeria. And today we are bringing back our very good leader, our very good gynotherapist, and she has taught us before about gynotherapy. And today she's going to explain about pregnancy. Prevention starts in pregnancy. And you know her very well. You've watched her programs worldwide. She is a wellness and disease management expert. She's a gynotherapist. She is a trained and satisfied registered nurse, even from the UK. She has gone far and wide and linking her vision with the vision of DXN. And once more, she's going to tell us more about how we can use the product in prevention for a better and healthy pregnancy with mother and child. Because I always say this, husbands, your spouse, you should be ready also. Because when your wife is pregnant, the husband is pregnant. And today, I bring to you Miss Jane Yon. Nice to meet you again. It's been a privilege to have you once more with us. You're welcome, Ma.
Good morning, Mr. Samuel. Thank you for this arrangement. And I wish all our DXN members good health.
Thank you, Ma.
See you at the top of DXN.
Sure.
Okay. So today's topic, prevention starts from pregnancy, BDSM products. Huh?
Yes.
So as you can see, prevention is very, very important, especially we want to achieve health, wealth, and happiness. Right. Let's look at human lifespan. Right. Human lifespan should be 120 years old. Can you see my slide, Mr. Samuel? Mr. Samuel, can you see the slides? Hello?
Sure, I can see the slide.
You can see?
Yes, perfect slide.
You can see my slide, huh? Okay, that's most important. Right. Yes, now, human age should be 120 years old. However, most people are unable to achieve 120. Why? Because due to poor health span, people are suffering from diseases, and especially the degenerative diseases. Yeah. So, in fact, I can see a lot of young people today. My youngest young adult at 25 years old had a stroke. And a 30 years old young lady with leukemia. A 40 years old man with liver cancer. So you can see people all walks of life, due to a poor health span, they are unable to achieve longevity. And what about the children? If I take you to the children's hospital, you will see that many children are suffering from childhood diseases. They even have cancer, leukemia. What is happening? So we have to go back to pregnancy, because during the pregnancy, whatever toxins, infections, all these can affect the health of the fetus. The fetus is under attack. When the mother is pregnant, our goal is the mother is healthy and the baby is healthy. But today, we see that many mothers, they don't realize they are facing lots of toxins, lots of radiation, especially mobile phone, computer, and even communicable diseases like infections. We have a lot of dangerous virus. We have a lot of dangerous bacteria. So all this can affect the fetus DNA. You can see toxins are everywhere. We talk about toxins in the food, drinking water with toxins, water pollution, air pollution. Now, of course, it is advised by many professionals that eating fruits and vegetables are very good for pregnant mothers. But how safe and nutritious are our crops today? You know, when the farmers spray their pesticides, they are well equipped with their costumes to protect them from the pesticide. They can't even breathe the air with pesticides. So is it safe to eat the crops? And also the farmers use commercial fertilizers. And there are so many reports has written, those frogs near the pesticides farms or even in the pond, they found some defected frogs. And of course, there are so many genetically modified crops today. And the livestock, hidden growth hormones. And of course, the growth hormones, antibiotics, and even all this affect our chicken, our cows. And what about the seafood? Deep sea food today is contaminated with heavy metals like mercury. And most of us like to eat salmon, cockle, shellfish, etc. And look at the seabed creatures today. A lot of people, they don't realize all these seabed creatures, they are so toxic. You know, shellfish, actually, they are contagious by nature, will have high toxic because they consume dead animals, debris, and especially look at the crabs. They sweep the ocean floors, consuming anything that is in the sea, and you can see all this seawater is contaminated with heavy metals. So all this seafood is heavily polluted. What about hidden toxins in the processed food? How come most of the food on the shelf life can last for so long? Due to the preservatives. And of course, a lot of fast food contains trans fat, food additives, high fructose corn syrup, artificial colors. Ask yourself, how balanced is our diet? Ideally, we should be taking more alkaline food like fruits and vegetables than acidic food like meat and refined food. But most of us, we take it the other way around. And another big problem is due to commercial cultivation and our crops are lack of micronutrients. And in the 1950s, you can see they will survey one bowl of spinach, you can get enough iron. However, today, you need to take 40 bowls of spinach to fulfill the daily iron that you can consume. Now look at this food pyramid. This is a healthy eating pyramid developed by the Harvard School of Public Health. You can see if we can follow this food pyramid completely, it can comply. Why? At the side of this food pyramid, there is one bottle of multivitamins for you, and there's a glass of wine for you. It means that even you comply with this food pyramid, we are unable to get complete nutrients to support our body. And of course, you can see most of the plant, they look beautiful, and however, due to soil depletion of nutrients, most of the crops they were eating is lack of micronutrients. Another problem for us is poor eating habits. Ideally, we should be eating a lot of alkaline food, fruits and vegetables. But today, people are eating too much refined food, too much carbohydrate, and this can cause obesity. And when you have obesity during pregnancy, it is very dangerous because it can increase the risk of almost all pregnancy complications like gestational hypertension, gestational diabetes, and of course, you deliver large babies. When the baby is too large, during delivery, the mother will have problems, and there is a lot of risk during delivery. Of course, obesity can have higher incidence of congenital defects in the babies. How clean is your water? In fact, our water, it contains a lot of toxins, not only the chlorines, fluoride, heavy metals, and of course the water piping system, the leaching of the heavy metals. And of course, we enjoy our shower, enjoy our bath, and do you know all this chlorine water? It can cause a lot of inflammation in our blood vessels. And what about the public swimming pool? The chlorine level in the public swimming pool is so high. And all this can cause toxins in the body. Today, we live in the world of computer world, and it's full of radiation. I remember many years ago, one of my pregnant mother, because her husband was far away, and every weekend she will make a phone call to the husband in outstation, and she will put a handphone on her abdomen, talking to daddy. So can you imagine this type of radiation is so bad because it can cause the DNA in the fetus. Maternal immunity is very important because if the mother has poor immunity, the mother has infection. And this infection can be quite frightening because not only the virus will affect the mother, and it can affect the unborn child. Like a German measles, chicken pox, hepatitis B, even a simple urinary tract infection, and then the sexually transmitted infections, all these microbes can affect the fetus. Especially rubella, we call it, or German measles. If the mother contacted the German measles and the gestation is the first 12 weeks, it can cause a lot of congenital multiple defects in the fetus, like blindness, and then of course it can affect the ear, so affect the hearing, and congenital heart defect. So most of the fetus will be born multiple defects. And hepatitis B is common, very common today. So it's important for the pregnant mother to know their hepatitis B status during pregnancy in order to prevent passing the virus to their newborn babies during delivery. Because during the delivery, the hepatitis B virus can be passed on to the baby. And of course, if the baby carries this hepatitis B virus, so it can cause chronic hepatitis B in future for the child. So it's very important for the mother to vaccinate hepatitis B before pregnancy, or even when the baby is born, it should be vaccinated, the hepatitis B vaccine, if the mother is a carrier. Now let's look at the development of the fetus. How toxins and radiation can affect babies in different stages. You look at the first 12 weeks of the gestation, and the vital organs of the unborn child. You can see the brain is developing, and the spinal cord, the heart, the arms, and then of course the ears, eyes, etc. Most of the vital organs are developing in the first 12 weeks of gestation. So during this period of time, it is very important the pregnant mother has good immune system, protect herself from the infection, dangerous virus, and also protect herself from the exposure of toxins and radiation. Because if during this development of the vital organs and the development is interrupted, congenital defect of the child can develop. Of course, after the 12-week gestations, the child is developing in the womb of the mother, and we will have to ensure the mother is also protect herself from all the dangerous virus, radiation, and toxins, because all these toxins can affect the DNA in the unborn child, which can affect the health status in the child in the future. So childhood disease can actually be prevented, like acute leukemia, brain tumors, lymphoma, diabetes, autoimmune disease. And of course, all these problems, contributing factors, infections due to poor immune system in the mother, and of course the environmental factors, water pollution, air pollution, and toxins, hidden food with toxins. So how can we protect your baby? It is very important. Prevention starts in pregnancy because toxins is everywhere. Keys of having healthy fetus development. We need to have good circulation. Good blood circulation is very important in maternal health because it ensures nutritive supply to the fetus. And good blood circulation also ensures good oxygen supply to the fetus. And then good immunity in the mother, protect the mother from the infection, and also protect the child from the dangerous microbes. And there is another important factor. When the mother has toxins in the body, the toxins needs to be removed from the mother before it reaches the fetus. So these are the keys of having healthy fetus development. I have been in DXN for almost 20 years. So of course, I work in maternal and child hospital for a long time, and I've seen so many cases, problems in childhood, which can be easily prevented. So when I came across Reishi Gano, is such a wonderful product. I started to use it for almost 20 years, and I recommend to most of my pregnant mothers during pregnancy. What is Reishi Gano? And of course, we know that DSN RG is very nutritious. It contains more than 400 bioactive ingredients. And of course, DSN Gadudama is so unique because due to Dr. Lim's research, since 1980s, you can see that we have 6 varieties of very nutritive red mushrooms. Let's look into RZ, why it is so nutritive. Researchers have discovered more than 400 bioactive ingredients found in Gadodama lucidum that give therapeutic effects to humans. Here are some very important nutrients that we will look into it, especially the polysaccharides. The polysaccharides in the mushrooms, in the Gadodama, boost and modulate the immune system. So it balances the immune system. And then, of course, it contains adenosine, improved blood circulation. The tritryptophan in Gadodama, which is the bitter taste of the RZ, it increases and help us to boost, to cope with stress resistance. And it also contains organic germanium. It improves cellular oxygenation. And the ganoderic acid, it is a cardiovascular, and it's a heart protector and the liver protector. So I would like to highlight some health benefits of RZ. RZ improves blood circulation. When the circulation is good in maternal circulation, of course, to the placenta also you need good circulation, so that the nutrients and oxygen will be transported from the placenta to the unborn child or the fetus. And of course, importantly, the toxins has to be eliminated. We know very well that RZ removes fat and water-soluble toxins. So therefore, Gadodama is able to enhance body detoxification. So during pregnancy, RZ is able to remove toxins from the mother before it reaches the baby. And of course, pregnant mothers, during pregnancy, they could have some hormonal changes. So they may have some imbalance in their hormones. And RZ contains tritryptophan as adaptogens that is able to increase their stress resistance and modulate their homeostasis in the body. So actually, what are adaptogens? They are raw materials from nutrition which help to increase bodily resistance to a wide array of biological, physical, chemical, and emotional stress factors that may affect our body, our balance. So we are able to balance our homeostasis, and we are able to cope with all this stress in the body. What is GL? Actually, GL, Ganosylium, is the root of the Gadodama. As you can see, before the mushrooms comes out, the root of the mushrooms will sprout first. And of course, in DXN is an expert in culture myceliums. And this is, of course, is Dr. Lim's profession. And what are the nutrients in GL? The most important nutrient is polysaccharide, organic germaniums, and you have a wide spectrum of enzymes and whole spectrum of vitamins and wide spectrum of minerals. You can see that if you make comparison, the RZ polysaccharide is slightly lower. It's about 30%, whereas in GL is very rich in polysaccharide. So it is about 80%. So GL contains lots of polysaccharide for immune system. So what are the benefits of GL or Ganosylium? GL enhances oxygenation in the body because it improves the permeability of oxygen into the cells, especially for the fetus. And the good oxygen level of the body ensure a healthy cells of the mother and the baby. So oxygen plays a very important role for the mother and baby. GL contains a lot of polysaccharide, and this is the key nutrients to enhance the immunity of the mother. When the mother has good immunity, she's able to protect the fetus from harmful infection. And GL is a good brain tonic. We know very well that the fetus, the unborn child, during the development, especially the first 3 months of the conception, the vital organs are developing and the brain is developing. So we need a very good nutrients to ensure the fetus, the brain development have good nutrients. And GL is the best brain tonic for the brain development. And don't forget that the unborn child is exposed to a lot of toxins, radiations, free radicals, and a lot of DNA can be damaged. And these polysaccharides can repair the damaged cells in the unborn child. And GL, we know very well that it regulates bone marrow. The polysaccharide gluten D6 is a chain from Ganoderma mycelium, is essential to rebuild bone marrow. And of course, we know that bone marrow is a factory for immune cells, the blood cells, and is also good for stem cells production. So therefore, bone marrow function, you can maintain an optimum bone marrow function. So we will have healthy healing, good healing abilities for the child in future. I would like to highlight RG and GL health benefits. Why RG and GL? DXN gives you RG and GL. We know that RG and GL has very good scanning effect. It has detoxifying effect, regulating the body, reconstruction the body, and also regeneration the body. Now, when we take RG and GL together, the detoxification can be complete. Look at the poor blood environment. Okay, you can look at this poor blood environment, and of course you could have a lot of toxins in your blood environment. So when RG open up the minute blood vessels that can be clogged due to acidic body and due to inflammation, then a lot of toxins can be drawn out from the cells. Okay, this is done by RG. And then the GL, the polysaccharide will down the membrane, will strengthen the cell membrane. So the toxins can be floating in the interstitial fluids or in the blood circulation. However, it's finding its way out to the detoxification system, that the liver, that the kidney, the lungs, right? And then, of course, and through the skin also. But the toxins that is in the blood or interstitial area, it will not reverse. back to the cell. So it finds its way slowly, the toxins is being eliminated to the cellular level. Is RG and GL safe for pregnant mothers? Well, I have used it for 20 years. Many mothers and babies, of course, those babies, some of them are already in their teens, and some of them are in the university. Of course, they are healthy and they are intelligent. Okay, but of course, there are a lot of researchers has confirmed Ganoderma lucidum is safe for pregnant mothers. And when we give something to a pregnant mother, we have to ensure that it's safe for the mother and the babies. Of course, our DXN RGGL, we have TGA. We have TGA issued by the Australian government, Department of Health, which is Therapeutic Good Administration. Okay, and the Therapeutic Good Administration actually it is a body that approves most of the food supplements. And of course, we have ISO 14001, which is environmental safe certification. Okay, and of course, you go back to the history, Ganoderma in TCM context, you can see that at the top list, Ganoderma is at the top list. Yeah? What does it mean? If we go into hierarchy of herbs in TCM, they are divided into 3 categories. You can see you have superior, average, and fair. Now, superior actually they are considered as food. It has balancing effect, it can have preventive effect, and of course it can be taken as food in long term without side effects. So superior herbs is considered as food. However, if you go to the second category, which is average, and all this, the Chinese use it as tonic, and they use it periodically. They cannot use it in long term because it can cause side effects. And of course, the third category, the fair, and it controls the symptoms, and it can be, if it taken long term, of course, it can be toxic. So Ganoderma is considered as superior, so it's categorized as food. And if you look at the Compendium of Bacteria Medica in TCM, Ganoderma is considered as superfood here. Okay, and there is no toxic effect. And the history have proved that. And you can also see that according to this Compendium of Bacteria Medica, Ganoderma can be consumed like vegetables. Actually, Ganoderma is mushroom, is vegetables. Another product which is very important for pregnant mothers, and I would say is essential for pregnant mothers, is spirulina. What is DXN spirulina? DXN spirulina actually is blue-green algae, and it is a complete superfood in which it contains essential and non-essential amino acids that is highly absorbable. Yeah. It also contains wide spectrums of micronutrients, wide spectrums of different pigments, beta carotene, chlorophyll, and then of course the xanthophyll, and high in polysaccharides. Why DXN spirulina is so unique? For those who have gone to Malaysia and visited our farm, you can see the environmental control of the of the spirulina is very strict. That's why we have ISO 14001, okay, with a clean water environment, okay. And why it's so unique? Because in Malaysia, we have sunlight all the year round. Therefore, our spirulina is very rich in chlorophyll. What are the benefits of spirulina? Spirulina is very essential in pregnant mothers because it's a complete food, and of course it enhance immunity, and it has antivirus, and of course it make good red blood cells, and it contains all the nutrients for not only for the fetus, for the maternal health. Okay, so there are a lot of researchers have confirmed that spirulina has anti-radiation effects, right? Let's look at why spirulina is complete wholesome food. And of course, with the whole range of phytonutrients, calcium, proteins, etc., all the nutrients that you have, is a superfood for fetal development and also maternal health. And most importantly, it strengthens the mother's womb during pregnancy and the complete nutrients for the fetus physical and mental development. Apart from the complete nutrient found in spirulina, is able to strengthen the immune system of the mother to fight the infection, and it minimizes the risk of infection. And of course, spirulina improves blood quality. We know that pregnant mothers to have good hemoglobin count and good red blood count is very important, because anemia in pregnant mothers can cause a lot of problems. Because if the mother has anemia, the baby will be lack of oxygen supply, and the mother during delivery, she can have hemorrhage. So good blood count in pregnant mothers is very important. Enable the body to produce new supply of red blood cells, because spirulina contains a lot of iron, yeah, and also very rich in chlorophyll. And of course, you know, the red blood cells have its lifespan. Normally it's 120 days old, and then the red blood cell will disintegrate. And of course, with spirulina, it will strengthen the red blood cell, enhance the lifespan, okay, and you can build new red blood cells at all times. So you don't use the old red recycled blood cells. So the oxygen carrying capacity is higher. And many clinical studies have suggested that spirulina is able to reduce nephrotoxicity by heavy metals, drugs, and radiation. So taking spirulina is very good to protect the DNA in the unborn child. Now, how to take DSM products during pregnancy? Now, my recommendation for a healthy mother, if the mother is healthy and is eating well, she can take 6 algae 6 GL and then 10 spirulina daily. But if the mother has the health status is not so healthy, then of course you take extra GL is no issue, because GL contains so much micronutrients to enhance the immunity of the mother and also for the fetus. And of course, the spirulina, you can take 10 to 30 tablets, is no problem. And GL contains polysaccharides and organic germanium, which can enhance the mother's immunity. This is very important, okay? And of course, the polysaccharide in GL can repair defective DNA. The polysaccharide is able to enhance the fetus brain function. And that is all we want, to have a healthy fetus. And when the child is delivered, we have a healthy baby. And RG, why RG is important during pregnancy? Because it can eliminate the toxins in the mother's body before the toxins reach the fetus. Now, spirulina is not only the nutrients there to support the maternal and child health. It is able to eliminate radiations. And then, of course, the nutrients for maternal and child health development, the mother's immunity. And now this is my own findings for mothers who are taking spirulina during pregnancy. Most of my mothers, they take 10 to 30 tablets during pregnancies. And they, of course, they don't take any multivites from the maternal clinic. So I discovered that those mothers who are taking spirulina, their newborn babies, they are unlikely to develop neonatal jaundice. And during delivery, how our DSM products can support maternal mother during delivery. When a pregnant mother is taking RGGL and spirulina throughout her pregnancy, her health status is very good. She has good quality platelets, good quality red blood cells. Okay, and this will reduce the risk of hemorrhage. Hemorrhage means bleeding during delivery. So for the baby, it is very important when mother taking lots of GL. So the oxygen level in the mother is very optimal. And of course, this oxygen level will optimize the fetus oxygen level. So if during the delivery process, if there's any interruption during the delivery process, the risk of hypoxia meaning the unborn child will be lack of oxygen, and this can be reduced. Therefore, we can ensure a healthy mother and baby. And of course, RGGL is safe because we have certification, TGA, we have ISO 14001, and this is one of the testimony I am proud to share with you. And actually now the babies are already 6 years old, 6 years old. Okay, so there was a lady, she was actually she was having twins, and of course having twins, they tend to have more complications. So the mother started to develop gestational diabetes, and she has sugar, and also she has hypertension. So she was very worried, and the doctor admitted her to the hospital. So they thought that, you know, if the mother is not so healthy, maybe they will have to do earlier delivery. Maybe she will end up with cesarean section. Yeah. So the mother came to me. I gave her lots of GL. Yeah, lots of GL. And a lot of spirulina and some RG. Of course, I gave her some Morinji. Yeah, Morinji. So throughout her late pregnancy, you can see that, you know, she had already developed gestational diabetes. She had high blood pressure, so she could carry her baby to almost term. So the babies, the twin babies, were born at 36 weeks, which was actually very good. And the weight of the twins, you can see, very good birth weight. The baby girl was 2.5, and the second baby was a boy at 2.3. So they had a very good delivery, and then you can see the non-identical twins were so beautiful. Of course, now they're so intelligent and healthy. They are 6 years old, and when they go to preschool now, they're both doing very well in school, yeah, and very healthy. So my happiness throughout my DXN journey, yeah, prevention is still our priority, yeah, priority. Of course, I'm glad to tell you that DXN products not only for this generation, for those who are here today, please be reminded that we are here to build a better generation tomorrow. Not only the next generation, the generations and generations to come. And please spread our passionate heart, spread our knowledge and wisdom to people all over the globe. So all the best to you, and let us have a better tomorrow. Thank you.
Oh, thank you very much, Ma. It's been an amazing, amazing. I've been jotting because knowledge, of course, is power, and you keep dishing out years of experience with DXM product, and it's been inspiring.
Okay.
Can you hear me?
Okay, I can hear you. Okay, Samuel. Okay.
Oh,
right.
okay.
The product is for generation to generations who have good generations in the future.
Sure. It's been amazing. Viewers, we've heard it from the expert herself, and she has given us years of experience on how we can help our unborn babies and our pregnant wives, even women, even you're pregnant, start immediately to help your baby to be healthy and strong enough. Also, for the brain development, it is very, 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 very important. Thank you all. I'm seeing people from Zambia, from Ethiopia, from Italy, or from Warri, Nigeria. Yeah, I can see everybody. Oh, thank you very much for coming live from Malaysia. Oh, thank you very much. Always appreciate your all amazing audience so far. Canada, I appreciate you all for coming live. Okay, we can start sending our questions. We have a few minutes. We can ask the question. But my question first is, in all this, why is Aruji taking less than others?
Oh, okay. That's a good question, Actually, there is no harm. You can take more RG. But, some mothers, they are afraid of healing crisis. So during the detoxification, they can have healing crisis. So I have make it a standard 6 for pregnant mothers. But for those healthy mothers, and they are facing a very stressful life, and then they are especially their diet is not so healthy. Okay, even some mothers they smoke. Okay, and then they can take 6, 12, 15 is no issue.
Okay.
Oh,
that's good. Okay. People are saying I'm not calling their country. Okay, you have a guest from South Africa. Oh, nice to meet you from South Africa. From Peru. Okay, thank you very much. From Ethiopia, from the Philippines. Okay, I appreciate everybody. Even from Nigeria, yeah, I appreciate everybody for coming live. Okay, someone is asking a question. Natal Tete. He said, good morning, DXN. Please, which of the DXN products good for eye problem?
Okay. Spirulina is the best product for eye problems, okay? So it contains all the nutrients for the eye, yeah? For the eye, especially the beta carotene and all that, yeah? So for eye problem, it's better for you to chew the tablets, okay? When you chew the tablets, the nutrients is target. It will target to the eye, so it will do the healing there. Yeah, why you have to chew? Because when you swallow it, your spirulina, the nutrient go to the stomach, through digestion, and then through the blood circulation, and then it's all over your body, and very minimum nutrient will go to the eye. So when you have problem, we do target, 2 target, okay? Chew a tablet, 5 tablets 3 times a day, 15 tablets. And if you think you have financial, you can afford, you can chew 30 tablets, it's no issue. But don't forget, GL and RD is also good for eye problem, because the question did not specify what kind of eye problem. Okay, you can have glaucoma, you can have hypertension in the eye. Okay, so these are eyes problem, and you can have floaters in the eye due to degeneration. So chew the capsules. You can put 1 cap RG, 1 GL. You put in the mouth. Actually, the capsule can dissolve. Okay, when you suck it, you do target. You can take 6 pairs, 12 pairs, no issue. Okay? Have I answered your questions?
Perfect, ma. Perfect, ma. So they should chew spirulina. They should chew 5 tablets to 15 tablets daily. Then RDGL. Oh, yes. Perfect, perfect, perfect. Oh, that's very nice. Okay, next question coming in. Miss Shetri. Okay, Mr. Shetri Nabin. He said, can we give Morinzi juice to a liver cancer patient, ma'am? And we give Morinzi for eye problem. I think he's asking almost the same question. Whether we can give Morinzi for liver patient or eye problem patient.
Okay, I will answer the small problem first. Huh? Of course, Morinzi, I just deliver a training in Turkey. Okay, Morinzi actually is very good for eyes also, because the noni juice, the Morinzi contains noni juice and roselle. Okay, and one of the function of noni, it can dilate the microcirculations. So for those people with eye problems, and either you have eye hypertension or you have infection, okay, have inflammation, and Morinzi is very good. Okay, suck it. You can suck 20 ml, which is 2 tablespoons. 2 tablespoons 2 times, 3 times a day is no issue. Okay, and it is also anti-inflammation. Okay, so it's good for eye problem. Combined with the spirulina, with the RG and GL, oh, it's synergized together, it works wonders. Okay, right. Now, the other question about liver cancer. Liver cancer. Now, actually, cancer is so common today. And of course, you look at the, Morinzi contains noni, which is a juice, and roselle is anti-inflammation, and then of course it can repair cells to the cellular level, enhance immunity, etc. So for those people with cancer, they go through a lot of medical treatment. Okay, they could have radiotherapy or immunotherapy, okay, radiotherapy, and all this can suppress their immune system, because all medical treatment, chemotherapy, etc., they don't only kill the cancer, but also suppress the immune system. Okay, not only you can drink Morinzi to support your immune system, okay, you can take lots of algae, GL, and spirulina.
Okay, I think that's answered the question very well. Okay, more questions coming in. Okay, Miss Rukaya Topiwala, she's saying, hi, good morning. How Ganoderma is useful for body weight loss?
This is a very good question for ladies and gentlemen, because today, because we love food, most of us love food, and then you don't exercise, lots of toxins, you see. So when I advise someone who want to achieve good weight loss, you must detox, because you know why? Toxins, they need a storage tank. Where are they stored? They stored in the adipose tissue. Where are the adipose tissue? All the fat our abdomen, yeah, all these adipose tissue accumulate a lot of toxins. And you can go on diet. You can go on diet, you can go take a lot of fruits and vegetables, and you exercise. But when you stop your diet or you stop exercise, and then your weight will rebound back. Why? Because the toxins are still there, and they need a storage tank. So therefore, all the fat tissue returns. So you become overweight again. So you don't have a good solution. Okay. So if you want to lose weight, detox. We have a good range of products, especially in Nigeria. Take Megadose. Yeah. You can take 15 RZ, 15 GL, or even you can take 30, 30. Well, in Malaysia, we have powder. It's very easy. Yeah,
we have powder too.
Yeah, we have powder. Powder, you just get a glass of water and open up all your 30 RG, 30 GL, okay? Half a bottle of Morinzi, half a bottle of Morinzi, get a shaker and shake it, and then you can take 30 spirulina. So my program is, if you want to lose weight, okay, you take regularly detox. You can take for 10 days, right? First thing in the morning, you get up. If you get up 6 o'clock to 8 o'clock, you don't take any food. You fast. You fast. You just drink the concoction, your 30 RG, 30 GL, and the 30 spirulina with your half bottle to 1 bottle of Morinzi. Just drink that throughout the 2 hours. Okay? And then in the mid-afternoon, you can have a light lunch. And then in the evening, you can have a light dinner. So throughout the 10 days during detox, you don't eat heavy meals, especially animal proteins, yeah, animal proteins, and then of course the dairy products like milk, cheese, etc. Okay, so because all these toxins will hamper your absorption of nutrients. Yeah? So your body will response, and then once your detoxification is done for 10 days, you can go back to your normal dose. Your normal dose, because you need to go on the gynotherapy for a period of time so that your toxins is all out. Yeah, you can take 6 RZ, 6 GL, 10 spirulina, and 30 ml Morinzi for 20 days, and then you detox again. Okay, but don't forget, when you do all this detox program, drink enough water, have a good sleep at the right time, meaning you sleep at 11 o'clock at night, 12, 1, 2, 3, your liver will rejuvenate, so it will rejuvenate and to help you to detox better. Okay, but if you, during the detoxification, you torture yourself, don't have enough sleep, and then you don't drink enough water, you cannot eliminate toxins completely. So you have to comply, right? Okay, detox 10 days with Megadose, and then take minimum dose, and then you must sleep at the right time, drink enough water, and regular exercise. The exercise, like my age, I'm 65, so I just do slow jogging every morning. So be consistent. Once your toxins is out, you sweat, so you can maintain good weight.
God, thank you very much. That's very, very explanatory. Very, very okay. I have so many questions coming in here. So many questions. I saw one now, Mr. Sisi Raja. Oh, my friend, Mr. Sisi. He's saying, "Good morning, DXN, watching from India. My question is, from which stage onward we can give the products to infants, and what quantity?"
Mr. Rajan, this is a good question. Well, of course, I started you with pregnancy, but by right, all the young couple, young man and young lady, you start before even pregnancy. Okay? Meaning, when you got married, before you start your family, you detox your body, okay? So that the husband will have healthy sperm, okay? And the lady will have good physical, good balanced endocrine system. She has a very healthy womb. She has a healthy ovary, so that when you get married, you have healthy the conception, and of course, the fetus will be healthy. Okay, as early as even you do not know you're pregnant, it's okay. Carry on with the LGGL, because most of them they maintain 6 LG6GL, yeah, and then 10 spirulina, and then about 30 Morinzi. That is their normal. But during pregnancy, okay, you can maintain 6 LG, 6GL. You can even go to 12 LG, 12GL, and then of course you increase the spirulina gradually. You can start as early as when you know you're pregnant.
Okay, what about the infants now? What about the kids? At what stage will we start administering DXM products to them?
The baby. You mean the baby?
Yes,
okay.
yes.
Once the baby is born, okay, I want to share this testimony. Yeah, I had a couple, a couple who deliver a baby girl, yeah. And of course, during the pregnancy, the mother was facing a lot of radiation, computer, even she cooked in the kitchen, there are a lot of radiation, etc. So she did not realize the baby was affected. Yeah. So when the couple gave me a call, it was a 1-day-old baby. When the doctor checked the baby's thyroid stimulating hormone, the child had very low thyroid stimulating hormone. So it was a bad news, because the parents were informed that the baby has to be on thyroxine for life. So I told the parents, no, if you put the baby on thyroxine for life, that means the thyroid will never function again, because the thyroxine function is taken over by the synthetic thyroxine. So your thyroid, okay, I no need to do work. Okay. So I told the mother, put 1 capsule of GL every day with her breast milk, and the baby took it every day. And 1 month later, the mother called me. She was so excited. She was so happy, because when the doctor checked the baby's blood, they started to find some thyroid stimulating hormones. And then they increased the GL. As the child grows, 2 months, 3 months, they gave 2 capsules, 3 capsules, even 4 capsules every day. By 3 months, the thyroid stimulating hormone is normal. Why I want to tell this story? I told you, pregnant mothers, they are exposed to a lot of hidden toxins in the food, the pesticides, okay, and the radiation, the water pollution. So you do not know what kind of toxin is affecting our unborn child DNA. The child can be born, looks healthy, but you do not know which part of the child DNA is affected. This is very important. We start the child, the baby, as early as possible, okay? If you want to start the child, if the child has no problem, after full moon 1 month, you can start giving GL all the way through, because we want to repair any DNA that is being damaged during pregnancy. And in long term, why we have childhood leukemia? And all this, nobody will tell you why. But my personal opinion, it could be during the pregnancy, some toxins, some radiation already affected the bone marrow in the unborn child. And as the child grows up, you're feeding the child with unhealthy food again, toxins again, and all these defected DNA, it can be triggered into problems. So start as early as you can. Once the child is about 3 months, 4 months, okay, then when the child is taking semi-solids, that's the best time you feed the child. In the porridge, in the baby food, you can put 2-3 capsules per GL, and you crush your spirulina, 2-3 tablets of the spirulina, mix it with the baby food. It's more nutritious than you're feeding the child with the baby food from the jar. because all these are natural, functional, protect your baby from dangerous virus, so your child would not have frequent cough and cold. Okay, and then of course, even now we have so many dangerous viruses around. You don't have to worry that your child will catch any dangerous bugs out there. Okay, so protect your child, enhance their immunity.
Thank you, ma'am. Start early to protect your child. Very, very, very important. Okay, next question, Ms. Flavor Quito Quadros is saying, good morning, DXM. What about varicose veins, please? What DXM products I can recommend? Thanks for the answer.
Okay, so actually varicose veins is due to, the veins muscle is not so strong, yeah, not so supportive, yeah. And then of course, and it could be due to a poor blood environment. Poor blood environment meaning most of us, we are eating acidic food. Acidic food can come from the meat, can too much animal protein, and you don't exercise, your blood is sticky, and you don't you don't use your muscle in your leg more, or you're standing for too long. Okay, so your stagnation of blood at your lower legs. Yeah. Okay, so what are the best products to improve your blood circulation? Because varicose vein is something like hemorrhoids. I want to highlight something like hemorrhoids is another kind of varicose veins. Yeah, so you can take Morinzi. Morinzi is very good for blood circulation, improve your pH in the body. Okay, you can take 30 ml 2 times, 3 times. If you want to drink one bottle like Mr. Morinzi Laszlo, it's no issue. Okay, so I'm drinking half a bottle or 1 bottle every day. Okay, so and then you take RGL at least 6 RZ, 6 GL. All right, you can take more. You can take same half megadose like 15 RZ, 15 GL, and spirulina. Spirulina, you can take 10 tablets, 20 tablets, it's no issue. So the whole range of products improve your blood circulations. Okay, and then is also strengthen the muscles in your veins. Okay, so try not to be stagnant all the time. Walking, and then slow walk or slow jog every day to improve your muscles in your legs. Okay, so eventually the varicose vein will disappear.
Okay, thank you, Ma. So many questions coming up. I will have to rush them. Miss Tita Garcia, she's saying, hello, Ma'am Jane. My question is about a stage 5 kidney failure. What DXM products best recommend? Thank you very much.
Okay. Now, actually, you see, it's 5-stage kidney problems. Actually, it's a chronic disease, correct or not? It's because we have been, the patient has not been taking good care of the health, and they're torturing the body with a lot of toxins. Too much animal protein, and then too much salt, too much chemicals, so heavy metals, etc. All these already destroy most of the kidney filtration cells, nephrons, etc. And of course, with this kind of patient, surely would develop a lot of complications. Complications like the patient can be anemia. Okay, you are unable to produce enough red blood cells. Okay, and then the patient can have high blood pressure. Okay, and a lot of toxins like creatinine will be too high. Yeah, so this is a healing journey. Healing is a journey. You don't expect, okay, I take the DSM product 2 months, 3 months, you expect to see miracles. It took you many years to develop kidney failure, and then now you want to reverse back. Not only the kidney, okay, you have to look into a wider scope. What about the complications that has developed? So holistically, we are balancing your body. Okay, so you have to be patient, perseverance. Okay, so the best product, of course, is RGGL. Okay, with this kind of problem, we start them slowly. We cannot suddenly give them high dose, because you know why? They have so many complications, and then they will they can develop a lot of healing crisis, and the patient will not feel very comfortable. Okay, you can start with RZ and GL. one pair, the first week, one daily. Okay? For 7 days. Then you go to 2 pairs daily. And the third week, you go to 4 pairs daily. But if the patient has a lot of reaction during you increase the dosage, okay, then you slow down, right? That if the patient is quite comfortable, then you go to 4 pairs, 6 pairs, then 12 pairs, okay, then 18 pairs, okay, and then of course gradually you can go for higher dose. So this is slow motion, right? And then of course, in Nigeria, you don't have cordyceps, but it's okay. You can drink Morinzi. Yeah, Morinzi. You also start slow. You can 10 ml this week, next week 20 ml daily, yeah, 30 ml daily slowly, and you can drink up to 30 ml, 40 ml. It's no issue. Okay. Of course, when you have this what you call this kidney failure, you are restricted with fluids and all that, so you're unable to drink too much water and all that. So you just the Morinji, you know, no need to add water. Just sip it. Okay, and then you can also start Sprina, very low dose. 2 tablets, then increase slowly, 6 tablets, 8 tablets, and 10 tablets. Okay, but take care of the diet. When you have kidney failure, your body is unable to detox. Don't take too much animal proteins. Cut down your animal proteins. Yeah. So if you think you want to eat meat, you have to cut down to minimum a matchbox size. Okay. So you cannot eat like normal people, or you want to enjoy your meal and at the same time you want to heal your kidney. So let your kidney rest. When you take less toxins, your kidney can rest, so it can repair. And of course, when it repairs, DSM products are the nutrients for rejuvenation. Okay? Be patient, perseverance, and don't forget exercise. Okay? And stable emotion. Because you know, when you are emotional, stressful, angry all the time, and how is your body going to heal? Because when you're emotional, stressed, angry all the time, and most of your microcirculation and your endocrine system, you know, will shut down, and it will slow down your healing process. Be happy.
Okay, thank you very much. Thank you. Okay, Miss Itoha Messi from Warri, Nigeria. She's saying, good morning, Madam Jane Yon. Thanks so much for this educative section. My question is, spirulina effective for weak erection in men?
Okay. Oh, this is a very good question. I think all the men would like to hear the answer. Okay. You see, when man has weak erection, there are many factors. It can be caused by stress. Emotional problem. It can be caused by, of course, physical problem like poor circulation, poor nervous system, and all that. But you have the good range of product to support this man. Okay, of course, you support him with a RG and GL to improve circulation and all that. Okay, and then of course, this what you call Morinzi. Morinzi is very good for emotional stable. It can enhance your happy hormone. Okay, and then it has also very good endocrine. Yeah. What you call can improve your endocrine system. Okay, and then you take mega dose spirulina. Yes, it can improve weak erection. I've treated many with this. So you can take 30 tablets a day, and AlgaGL you can 15 pairs or 30 pairs, up to you, and Morinji you can take half a bottle a day.
Okay, Ms. Itoha, you've heard it. 30 spirulina, and you take the AlgaGL for the effective erection in men. Thank you very much, Ma. Okay, I think it's a women question this time around. Ma, my question is, what quantity must a lady consume to improve her hormones and egg quality in case of infertility?
Okay, right. Especially for women, due to unhealthy food, unhealthy food, and then stressful work and all that, it can affect your ovarian function. All right. I want to share with you. Last year, I had a child patient, 12 years old, with ovarian cyst.
Wow.
Can you imagine? 12 years old is not a young lady. She's a child. So when I interviewed the child, this child has been eating unhealthy food since childhood. Breakfast, she would like to eat hot dog, burger, and she ate very little fruits and vegetables, okay? And then at 12 years old, she went to school. She was very stressed. So when she came to me, her ovarian cyst was so huge. So she already had pain. And when she went to the hospital, the obstetrician had no choice but to remove her ovary. It's sad to hear a child of 12 years old, she lost one of her ovary. And the other ovary, the doctor said it wasn't healthy because it has a lot of spotty area in the ovary. So I told the parents, first, you have to teach the child to eat healthy food. Of course, take DSM products to reverse, because we know our DSM product, LGGL, spirulina, and Morinji, is able to do rejuvenation. So it's able to reverse the function of the ovary. So the child, of course, started to take LGGL, spirulina, even Morinji. Of course, now the child is quite healthy. Okay, this is something that I want to highlight. So this young lady, the question is, how do we make sure that you have good egg or good ova? Most thing you must have balanced hormone, healthy ovary, and healthy uterus. You have a good range, LGGL. Okay, if you're healthy, 6-LG6GL. But if you have infertility, okay, then you have to enhance your balance your hormone faster. Then you take 15 pairs or 30 pairs and 30 LGGL, half a bottle of Morinji a day, every day. I've treated many couples with infertility due to hormonal imbalance, and they have their babies.
Perfect. I think that would be. I just saw a question similar to what you were talking about, and it shows confirm what we're saying. It's saying which products used in ovarian cyst and left fallopian tube is blocked. Wow.
Okay. Now the ovarian cyst, as I said, ovarian cyst, she could be having ovarian cyst is one side, and then maybe the other side of the fallopian tube is blocked. Yeah. So this could be fallopian tube is blocked. It could be due to infection. Could be the infection. Or the cyst could be due to toxins, and then your stress, your unhealthy eating habits, etc. Okay. So you can start LGGL. Okay, 6 pair to 12 pair, even 15 pairs is no problem. Spirulina, 10 tablet, 20 tablet, and Morinji, etc. Because I told you that I have reversed so many ovarian cysts, to normal. So your ovarian cysts can be normalized. So try to cut down all your animal proteins that will affect your hormones. Because today I told you, just on my presentation, told you that most of the livestock, the meat contains a lot of growth hormones and all that, and all these can affect our estrogen and our female hormones. Okay, so cut down all those, take more plant-based, and then of course the block fallopian tube. You can go to your gynecology. Maybe they will blow whether it is able to blow and unblock the fallopian tube. Okay, but even if you have one healthy ovary, you can get pregnant. Okay.
So one healthy ovary can help also. Okay, that's nice. Okay, this is a very occurring issue in Nigeria right now. Say good morning, DXN. Miss Ndaleda, she's saying, good morning, dear. Watching here from Philippines. My question is how DXM products can help stroke patients. Thank you so much and God bless.
Okay. Now, stroke actually is so common. It's one of the most common, what I would say is a blood vessel related problems. Yeah. Okay. So due to poor eating habits, poor lifestyle, and then don't sleep at the right time, and you don't drink enough water. A lot of people today, they don't drink water. You know, young people today, they drink carbonated drinks and make their body is worse, is more acidic. I told you my youngest patient that has stroke was 25 years old. Okay, and then obesity. Okay, these are the things that we are torturing our body. Okay, what cause stroke? We have two kinds of stroke. One is our blood vessel is blocked. It can cause stroke. And the other one is because your blood vessel rupture and also can cause stroke. Okay. Oh, so we want to make sure that our blood vessel is healthy all the time, improve blood circulation. Algae-GL is the best. Yeah. Now, for this, if this patient has a stroke, now we have to do two things. One is to clean the blood circulation. Morinji is very good. Okay, Morinji is very good. You can put 30 ml, maybe 60 ml. Just drink it, add it in the water. Yeah, drink it 3 times, 4 times a day, just to make sure that the blood circulation is improved. Okay, and then you also give this Algae-NGL. Algae-NGL, especially if you want to do the targeted healing. Targeted healing, you just let the patient, suck 1 algae, 1 GL in the mouth and suck it, and we target. You do targeting, and the rest of the Algae-GL you can put in the water and drink it. Okay, you can put 6 algae, 6 GL in the water and drink it, and the other one you can suck it, 1 capsule, algae 1 GL, 2-3 times a day for sucking. All right. Don't forget spirulina for healing. So when you improve your blood circulation, when you have nutrients to repair the damaged cells, then we are able to help the stroke patient to recover. Okay, and of course the diet part, avoid most of the animal proteins and all that. So of course when the patient has stroke, we as a nursing family, the loved one at home, or maybe you have a helper at home, you have to make sure that stroke patient be mobilized. Okay, which part of the body you need to exercise, maybe passive at first, okay, and then make sure that the patient is mobilized. If he can walk, take him for a walk every day. So physical mobility is very important, and make sure that the patient is not so stressed, happy. Okay, you can sing songs, right, and tell story. So emotional stability is also important. It's partly for the healing process.
Okay, you can sing song for him and one word, one market, so that it will help him very, very much. Okay, thank you very much, Ma. Mr. Akbos, a Nigerian leader, is saying, can we recommend DXM products for a grown-up child with Down syndrome?
Okay. Now, Down syndrome actually is a congenital problem that, they are born that, that's why they are called Down syndrome. Maybe they have a slow learning and all that. But we as parents, if we have a Down syndrome child in the family, you just don't look at, oh, my child is Down syndrome, what can I help him? But we holistically look at the child. You look at Down syndrome child, most of them have poor immunity. It's so difficult to take care of Down syndrome babies. They have frequent cough and cold, and some of them, they have poor heart function, etc. So, but this one is a grown-up child. We want the child to be physically healthy heart, healthy lungs, healthy kidneys, and the child can play physically. And of course, with the DSM products, we are able to enhance the child's mentality to a certain stage. At least the brain cells, we know our brain cell will, as the child grows older, it will degenerate. And if you don't start now, as the child grows older, maybe 25, 35, and when the child has degeneration of the brain cells, that means the child, I think the brain function will deteriorate. So we have to boost it up. Boost it up. Let him grow up, have a quality life, physically healthy, mentally healthy. And we want to see this Down syndrome young child become a young adult and he have a good quality life in the long run. So you can give him RGGL as a child, you can give him 6-RG6GL, 10 spirulina, 30 to 60 Morinzi. So as the child grows older, you can start.
Perfect. RGGL, spirulina, and Morinzi to improve the immunity and the brain development of the child for Down syndrome. Okay, Ms. Teta is asking again, can I ask again about the prostate cancer? Has now stage 4 cancer. Wow.
Okay. Now, I want to tell you, my father had stage 4 cancer. If you go into my testimony, Jane Yao testimony, my father testimony, I came to DSM because of my father's illness. There was in the year 2000, when my father had a stroke, and later on he developed prostate cancer stage 4. My father's prostate cancer stage 4 was prostate cancer to extensive bone metastasis. Okay, so I do not know what is your stage 4 cancer, because the metastasis of the cancer can go into the liver, can go to the lungs, and can go to the bones. Okay, so let's see what kind of medical treatment you have gone through, whether the patient is on hormone therapy or is on chemotherapy or radiotherapy. Okay, however, DXN products is support the body. We must remember, we support the body, we enhance the immunity, yeah, and then we balance back the detoxification system, enhance the immunity, and enhance the oxygen in the body. So we are eliminating the cancer environment for the patient. Okay, so of course my father at that time, the doctor did not give my father a good chance to live, because it was so extensive, and my father was given 3 months to live. But with DSM products, my father was on mega dose. His life was extended to golden old age, 88. Yeah, that was 8 years more than what the doctor predicted. Okay, so for this case, whatever treatment you're on, either you're on chemotherapy or radiotherapy, on what you call the whatever treatment you're on, you go on mega dose DSM products. What you can go mega doses? Morinzi. Okay, Morinzi is very good to help you to improve your immunity, your circulation, and most importantly, the endocrine system. Prostate actually is endocrine problem. It can be hormone inducing. Yeah, you can take 1 bottle to 2 bottles. You can take mega dose, no issue at all. Okay, Morinzi, 2 bottles, and then spirulina, because surely cancer, prostate cancer is already spread to maybe to liver, to bones, etc. So the safest product for this patient to take, you can take mega dose spirulina, 30 tablets, 60 tablets, is no issue. So if you think it's too much for him to take, you pound it, grind it into powder, and mix it in with fruit juice. Okay, and then another product you can give high dose, GL. GL is very good for oxygenation, immunity. Well, in Nigeria, you have capsules. So you want to take mega dose, maybe it's easier for you to open up the capsule, 60 capsules in the water, 60 capsules in the water, okay? And you mix it with Morinzi, you drink. You can take 120 capsules of GL, is no issue. Okay, even more is no problem. Okay, the only thing that RG, it can give some healing crisis, and the patient can feel some discomfort. Okay, we still give, but slow. The rest all mega dose to protect the patient. But the RZ you can take, as I told you, first week 1 daily, then second week 2 daily, 4 daily, 6 daily, 12 daily, and then 15 daily, 18 daily, up to mega dose 30 daily till the patient is able to tolerate the megatose. Okay, and in his diet, avoid all animal protein, because animal protein is the one cause a lot of toxins in the body. And during healing, we want to heal your body. If you put on toxins, then your body will detox and heal, so it will slow down the healing process. So we have a clean body. We have a clean body, so your body can heal faster. So take lots of fruits and vegetables. Okay, and another thing you need to avoid is calcium, because a lot of researchers has confirmed hormone-inducing cancer like prostate or breast cancer, they must stop calcium or any dairy products. Okay, and take lots of plant-based food. Exercise, be healthy, be happy. Okay, and then we can sing song, and exercise. So the patient has to be emotionally stable, right? Don't think I have cancer and that I'm upset all the time, because that is something that most of the patient, they think they are unable to go through cancer. They're depressed and all that. Okay, we can live happily and cancer in harmony as long as our body environment is healthy. We have good oxygenation. We have good immunity. Yeah. So my father actually, throughout his 8 years, did his cancer go away in the bone? I saw some. In fact, I saw the bone scan, repeated bone scan. You still have some lesions. But how can my father, his life is extended for so long? Because he has a healthy body environment. Okay.
Correct. Okay. This is saying, Mr. Sekina is saying, good morning. Which products can we give to 1-year-old babies for weight gain?
1 year old.
Yeah.
Okay. Spirulina and GL is the best. Okay. So whatever food that you give, the baby food that you put, you can grind some spirulina. For 1 year old, you can take 5 tablets or even 10 tablets of spirulina. Is no issue, because it's a vegetable. Yeah, it's a vegetable. So you have all the calcium, all the protein, all the wide spectrum of nutrient, etc. And it is very easily digested by the child. You don't have to worry that he is unable to absorb. Okay, so and of course the child have poor weight gain could be due to some poor digestive system, or malabsorption of the nutrient. And the spirulina is also able to enhance the intestinal function. Okay, so you can give 10 spirulina and 10 GL, open up the capsules, and then of course you can divide the dose. If your child eat 3 meals a day, and then every meal you add some spirulina and GL. Okay.
Okay. I think we're going to end with this question. I saw a very long question. Oh, Mr. Igor Igele, our operation manager of DXN Nigeria, is saying, good morning, DXN. Thanks, Dr. Jane, for your great insight into the need for maintenance of good health. DXN remains indispensable, and the testimonies are really amazing. Please, can you tell us how we can make the intake of DXN products a habit?
How can we make the intake of these products a habit?
Yes.
That is a very good question. Thank you.
Yes.
Now, so that's why understanding the what do you call the function of the products is very important. Okay, so I have told you why RG is so important, why GL is so important, and why spirulina is so important, and why Morinji is so important. Now, my first session, the gynotherapy, I already told you. Okay, now we are facing with toxins every day. If I'm the mother, I always say my health is important, because I have to be healthy to take care of my husband and my children. If I am sick or I am ill, then who will be very upset? My husband will be upset, my children will be upset. So normally I would tell the children, okay, let us take care of ourselves. All right. And in my home, my RGGL, my spirulina, all my enzymes are freely available on my dining table. Okay, so first thing in the morning, many years ago, we would teach our children when they were young at that time. Okay, everyone would take at the same time. Okay, so after some time, they know, okay, mommy is taking, daddy is taking. So they become a habit. After some time, after 3 months, it became habit. So without Sprina, they cannot go to school. So that was how we built our habits, okay, I would tell my son, that time he was young, he had asthma, I say, okay, boy, you go to school, you may not have good nutrients. Okay, Sprina is the best. You take this, and then after that, when you go to school, even you don't have a good food, mommy don't care. Your nutrient is already replaced with your RGGL and Sprina. And the good thing was, I want to tell you this story. My son, when he was in university, and he understands so well that GL is a brain tonic, brain tonic, and Sprina is brain tonic. So, and then of course during the exam he had to stay up very late, and then sometimes he didn't even go to sleep because he said, I want to make sure that I can remember what I learned today. So every time I notice his exam time, I cannot find my GL in my house. My GL is all gone. My Sprina is all gone. Where are they? He's taking the whole back to the university. And so I said, that's good, because he know that he needs the nutrient for his brain and for his memory, for his study and all that. So I was very, very happy. Of course, today now my son is in my BSN team, and he's also one of the nutritional consultant here. So this is how we create health awareness. Yeah, I still remember, Mr. Kocholaslo, when we started this DSN in Hungary in the year 2008, and then 2009 we started. And Mr. Kocholaslo's daughter was very young. She was only 2. She was fussy. She didn't want to take this. Look at the Sprina. She was, that is lousy color and it tastes awful. How did Coach Laszlo and the wife encourage the child to take Sprina? Stuff it in the chocolate. Chocolate is a favorite food. Okay, so when I started to eat Sprina, and today, of course, the child is already in her teens. She's doing very well. She's studying very well. She's in the ballet, and they eat Sprina. It's just like peanuts, putting in their mouth. So this is how we as parents create health awareness. Try to encourage our young children and mix our DSM products, Sprina, RGGL, in their favorite food. Because when you put the you ask the baby take GL, of course the child will run away. Mix it. Try to mix it either in the fruit juice or in the soy milk or cow's milk, whatever it is. And when the child get used to it, so at least our child is being protected. Especially now, you do not know what kind of the next dangerous virus is coming. How do you protect our loved ones, especially young kids? They go to school exposed to virus, toxins, yeah? And then, and the coloring. And talk about coloring, I have another story to tell you. When my daughter, as a child, I started to give RGGL, yeah? She took about 3 RGGL. Before she took 3 RGGL, it was okay, she was happy, she went to school and then came back from the hot sun. In Malaysia, our uniform is white color. It's white color. So after she took RGGL for 2 months, what happened? I noticed something very strange. The white collar at the back become pink color. My girl was 7 years old at that time, and now she's 27, of course. Pink color. I was shocked. Why my daughter, before she took RGGL, her uniform was okay. But after she took RGGL, her uniform became pink color. I went to the school. What she was taking in the school? Colorful sweets and the beverage with colors. And those toxins, can you imagine? If she did not take RG and GL, it's stuck in the cells. Can you imagine? At 7 years old. Now she's 27 years old. She's beautiful young lady, healthy lady, and she's a dietitian, came back from Australia, and she's working one of the hospitals in Kuala Lumpur. So this is I try to get across is essential for people of walks of life.
It is essential for people of all walks of life. I think we're going to end with this last question from a Nigerian leader, Mrs. Udwak Onamso. She's saying, please, someone with, okay, thanks, Ms. Jenyon. She's saying, please, someone with colon cancer using DXM products now, but the tummy is swollen with little watery stooling. What is the complication there, and what's the next step to follow?
Okay, it looks like this colon cancer. Already the tumor can be quite big, and then it has already blocked the colon. Yeah, because when your colon is blocked, your feces cannot come out, so it's watery stool. Yeah, so it's best this patient seek medical treatment. So whether the patient needs surgery to remove the blockage. Okay, and then of course the patient could have some metastasis elsewhere, because from what I look at the symptoms, the cancer could have spread somewhere, and then you have some ascites and all that. The liver can be affected. It's okay. Seek medical treatment first. Yeah. So to release whatever blockage there. Well, of course, on my part, even the patient goes through surgery, and then he goes through chemotherapy, radiotherapy, you can combine with our DSM products. But now, at this moment, the best product to start with the patient now, take Megadose GL. Yeah, you open up the GL capsules. If you are in Nigeria, open up GL capsule, maybe 30 capsules in a glass of water, and put maybe 60 to 90 Morinzi, yeah, and she can drink 2 times, 3 times a day, okay, because that will enhance your immunity, and of course your immune system is able to attack the cancer. Okay, so we do not want the cancer to spread further. So seek medical treatment first. The immediate action now, you give lots of GL, lot of Spirina, and lots of Morinzi. All right, and then after whatever surgery, treatment, etc., then you can start a bit of RZ, as you said, 1, 2, 4, 6, 9, 12, 15, etc. Okay, because now the patient already had blockage. You do RZ, and then the patient have healing crisis, and the patient can have a lot of discomfort. So start with GL, Spirina, Morinzi, and seek medical treatment immediately. And the diet, colon cancer comes from toxins. Okay, stop all the animal proteins, yeah, milk products, and then exercise. Okay, walking exercise to enhance your lung function, heart function, so you have more oxygenation, and of course stable motion. Okay, so this is the advice, and I hope this patient will, throughout the journey of healing, you can get well.
Okay, thank you very much, Matt. I'm sorry, viewers, these are the much questions we can have. I know you have so many questions to ask. These are the more questions we can ask now. But finally, the question I want to ask, you always say on water, is it warm water or cold water?
Oh, okay. Thank you. Normally, the water that we mix with our DSM products, I would advise is room temperature. Room temperature, okay? Room temperature water is the best for all our DSM products. Okay, you can put in the shaker. Normally, I like to put in the shaker, and then you shake, yeah, 100 times, so that all the water molecules is broken up into smaller molecules and mixed very well, because our RGGL powder, they are all micro powderation. Okay, so it can even is put in your mouth and suck it. You can do targeted treatment, your brain, your eye, etc. Okay, so it's very easy for absorption. Okay, no hot water. I don't encourage hot water, because the hot water will destroy the phytonutrients in the RZ and GL.
Okay, thank you very much. To everybody, questions. I'm sorry if I didn't answer your question or ask your question. Please We'll do that next time we have Ms. Jane again, and all your questions will be answered. Thank you very much. Thank you very much, everybody, for your time, and thank you, Ma, for your time. I really appreciate. Tomorrow we have Sunya. It's very important that you reset your mind. You detoxify your mind. Also, while you are detoxifying your body, you need to detoxify your mind. So Sunya is happening tomorrow, and our trainer tomorrow will be our warehouse manager, Mr. Alex Olajide Olawale, and he will be the one to take us on the Sunya. On Saturday, we will be live in Warri, Delta State of Nigeria for a mega seminar, and we are going there to also to our prospective service center for the seminar and the training. Is an health and wealth talk with Samuel Zoro. Who is Samuel Zoro? Is Samuel Zoro. I am Samuel Zoro, marketing manager for DXN Nigeria. So see you all. Invite all your prospects. Invite all your downline to Warri, and the poster will be coming up live. It's being spread already on Facebook already. So please invite all your prospects to Warri, Delta, Nigeria by 11 a.m. We are starting and we are finishing by 1 p.m. Nigerian time. Thank you very much, Ma, for your time. Thank you.
Thank you.
I hope to see you very much. I know it's already almost 10 p.m. in Malaysia.
Okay. Okay. Yes. I would like to wish all our attendees today health, wealth, and happiness, and carry on with your health awareness teachings from generations to generation, and we'll build a better generation tomorrow. Thank you, and bye-bye.
Thank you very much, Ma. And that's all from the stables of DXN Nigeria. We're going to do this again very, very much next week. We keep doing this every Tuesday and Thursday. Keep living in health, wealth, and happiness. Good morning, DXN.
Bye-bye.
Bye-bye.